Okay.
Well, thank you for taking the time to speak with me. I'm very excited. And I need to introduce to all our listeners, Robert Rowen is one of my big heroes. I always say there is those warriors in this life that stand for a good cause and don't give up and fight and introduce and educate. And Robert is one of those people that has, brought ozone into the world. There is a lot of doctors in Germany who do it, but, to step outside of the arena of, your home remedy and to take something on board and fight for it in a country where it's not endorsed is a huge act of bravery, and I'm commending you for that, Robert. Thank you so much.
I'm really humbled by that. I did not expect that, especially since you only approached me to do this about 15 minutes ago.
Yeah, well, you've been always one of my big heroes, and yeah, I love ozone. See, when we started to work with ozone, I always thought, it's like any other remedy. You get good feedback from everything, but it drips and dribbles. And then we started to teach about ozone and home ozone use. And my God, I just had this morning a phone call where a lady was in tears crying after years and years of problems. Finally, getting rid of leaky gut and managing to heal the gut. And her whole life transformed. And when you hear things like that every single day, I'm passionate beyond with ozone, and I know you too. Now, you're offering a workshop for health professionals, for doctors that would like to offer ozone, not in the home remedy style, but actually in a clinical style to you and train them. So would you tell us a little bit about that workshop?
Absolutely. 3, sometimes 4 times a year, but this year it'll be 3. My wife and I, in conjunction with Howard Robbins, who does DIV, offer a weekend workshop, and it's usually Friday and Saturday. The one coming up is Friday and Saturday in August. It's August 7th and 8th. And yes, for about an hour to an hour and a half, we do teach the home remedies. Everyone needs to know how to do home remedies and teach their patients how to do that. So we teach the very best that you can do in home remedies, but that's only about an hour of the time, maybe even less. Our focus is teaching all of the injection techniques that a practitioner can possibly do. And we teach all of the joints. We teach epidural injections, prostate injections, even scrotal injections. Depending upon patients, we've done transvaginal injections. We've done neck injections, lumbar, sacroiliac, knee, ankle, you name it. We show how to do this. We emphasize hyperbaric oxygen as the major treatment for blood.
Yeah.
Howard is there to do a demonstration and give the basics of his direct intravenous technique. It's really wonderful. Everyone should know how to do this. But we mainly emphasize at this workshop hyperbaric ozone. We teach on a Zotzmann machine. I happen to like that machine, and that's what we stick with. That's my preference for reasons we won't get into. And we teach hyperbaric, and we also teach 10-pass. That's Lahodny's technique, ozone high dose therapy. I give him credit. We have modified it so that we use much less heparin than he taught us to do, much less. And we believe it's much safer. And so and all of the participants, if their veins permit, will get a 10-pass. And all of them will do a 10-pass. They also will see how you can combine ultraviolet therapy simultaneously with ozone. We teach that too. And a big bonus, yeah. And a big bonus with my workshop is I also teach an introduction of how to evaluate somebody for dental interferences. And this is crucially important. This work is German, basically. Yeah. Deutsche Neurotherapie from Hunecke. and I teach how to evaluate using kinesiology, because I don't like to fail when I treat somebody with ozone. That patient owns me, and I have to get a success. And a disturbance in the teeth can screw up your treatment.
Yeah.
So
we know that.
teach how to do that as part of the workshop. Additionally, on day 2, which is devoted to 10 pass, we have about an hour to an hour and a half didactic. The only didactic part, the only lecture part is for about an hour or an hour and a half on day 2, where we explain the physics of hyperbaric ozone, comparing it to DIV. The rest of this workshop is entirely practical, hands-on.
Cool, I come. I'm not allowed to travel. But yeah, I've had all the treatments that you talk about. And when we did our tour around the world to interview all the ozone doctors, I had a few 10-pass treatments, like you said, with more or less heparin. Everybody had their own little style. So I guess you have developed your tolerance levels, which is great. But yeah, it's been, for me, I never know why ozone does those different types of healings that it prefers in the body, and it's not our choice. Like I had a 10-pass treatment and came, or 4 or 5, and then came home and I couldn't see anymore. My eyes were so bad that I went to the optometrist and he said, Marcus, they aren't bad. They got much better.
They got better. Wow.
Near and far sight, both together. And you know, I'm 60 now, so my near sight went down by 2 dioptrines and my far sight by 1.5. So I needed thinner glasses because my eyes had fixed up.
I love it. That's wonderful.
And that was actually not the purpose why I did the treatment, but it was one of the side effects that came. So I was very happy about that. Yeah. Very good. And with the techniques that you teach, people have afterwards a certification. And what does that allow them to do? Well,
I'm not a real fan of this quote certification.
I agree.
It's largely bull. Societies, privately owned societies, teach and then certify.
Yeah.
That's not going to get you very far.
No.
In fact, that could get you in a lot of trouble. But we do give a certificate of completion, that you were trained by us and that you were trained in the hyperbaric technique. And the other thing that our workshop does so we give a certificate of completion, and that's really all we can do. And I don't think any other certification means anything else but that. I will tell you that our reviews are stunning. I am even stunned. The last workshop, we got 480 questions amongst 12 people. So you get 4 points. You know, you get score 1, 2, 3, and 4 is the best.
Yeah.
Out of a possible 480, we got 479.
Wow. Good.
This is all, yeah, wow. And it's recorded. And the comments from the doctors are on my YouTube channel. You can go to my YouTube channel and see comments of previous workshop participants. The other things our participants get is they get entry to our Ozone High Dose Forum, where you have to come to this workshop to get entry to this. And it's got what I think is probably the best discussion group in the world, probably the best practitioners in the world, because they've learned these methods. The other thing that they get is they'll get a year's free membership in Ozone Without Borders if they come for 2 days, and they pay the regular fee. And then another thing that's really valuable is we have a listing on our website of our trainees, and we're currently getting over 20,000 hits a year. And some of our trainees are telling us that it has made their practice. And we only list the people that we train because that's what people are looking for. So that's the final thing you get if you come to this workshop.
That's definitely a huge value, because Well, we're sold out. We're sold out. Every single delivery that we can get is gone before it even arrives. And I think that everybody says coronavirus is bad. I thought it brought us absolutely into the top limelight. So many doctors, so many clinicians, so many people are excited about learning about ozone, and it's been never before that popular. In Italy, in Germany, every country, we had sales of 200 devices to Italy. It was amazing, and now clinics are coming after, and we have no stock and can't produce fast enough.
Wow, I'm really happy for you. I am, and the viewer should know that while when we teach hyperbaric, I said we teach on the Zotzmann machine, but you don't need to do hyperbaric. I think hyperbaric is the best. We get unbelievable results with Lyme disease.
Fast results.
Faster results. It's faster.
Yeah.
I don't think the results in the long run are better than doing standard slow motion gravity treatments, but the results are much, much faster in our hands. So that's what we teach. We like it. Our patients want to get better fast, and that's what they come to us for, and that's what we teach.
Yeah, and they come because you're, in my opinion, one of the most passionate ozone doctors I know, and therefore it's always nice to learn from someone who just doesn't teach, but actually lives it. And that's why I recommend everybody to come and see you. And when they book for a ticket, and this is something important, they need to have a medical license.
We will only admit someone who is licensed to do injections.
Okay.
That includes medical doctors, osteopaths, veterinarians, dentists, chiropractors who are in jurisdictions that allow injections, and naturopaths. As long as their license permits injections, they're welcome to come.
Perfect.
It would include nurses, nurse practitioners, because they are licensed to do injections.
Yeah, but it doesn't give them a legal permit to do ozone treatments. It's still their own jurisdiction, whether they can and how they do it and how they offer it to clients.
Yes.
In regards to America, how does it work there? Because, if I teach private people how to treat themselves, that's completely legal. But to treat others is something that do you have any ideas on, when a practitioner endorses or does offer ozone treatments, how they keep themselves safe?
That depends upon your jurisdiction.
Okay.
Now, we don't want to teach a person who is not licensed to do injection therapy, because if something goes bad, we don't want ozone to get a bad name.
Exactly.
We are all about safety. I mean, we teach techniques of drawing blood, of doing the IV therapy, where you don't even see a drop of blood come out of the patient. People come from all over the world just to see our technique, because it is as clean as it could be, no blood. And
you have no clue. I've been to workshops where the cameraman and me both stood there and said, "Oh my God, I would run instead of have that done." So that's a commendable thing.
We don't, in a whole weekend of doing, if we have, let's say we had 12 people, that's pretty much what the limited seating. We have limited seating, and everyone got a treatment. If we saw one drop of blood, you saw a lot. That's pretty good. We also have a fabulous lunch, gluten-free, low lectin, mostly raw food, vegetarian, very gourmet. Now, you asked about jurisdictions. If it depends upon your jurisdiction. For example, I'm well known because in Alaska in 1990, I got the first law passed protecting alternative medicine in the history of North America. And that law has been duplicated in many other states, including California, and our medical board respects the law.
Wow.
And I've been before the medical board, and they respect the law. They're not attacking us for doing ozone therapy. Now, I can't speak for the next jurisdiction.
Yeah.
I will tell you that anybody that I train, I will defend at a reduced price, and we have not lost a case yet.
Like I said in the beginning, you know, heroes and people with passion are absolutely the best. So I think you don't need to add any more bonuses. Just to be listed on your website is already, you know, a bonus beyond. And I know people are looking for qualified advice. I told you when we did the interview about a year ago or something, 2 years almost, when we traveled around, it's so hard to find practitioners that really have that depth of knowledge that you show. And therefore, I think it's a no-brainer. If I would be in America and allowed to travel, I would definitely come.
Well, we've trained from every continent. We've trained from Australia, Africa, Asia, India, Europe. So we were Philippines. We're always excited to get people to come from around the world. Not everybody goes back and does the hyperbaric technique. Most do.
Yeah.
But the injection techniques are stunningly valuable. I think we were among the first to show how to do prostate injections. And the epidural method has helped a ton of patients who were not helped otherwise. And you don't need machines for this. And the other thing that I do, remember I told you about dental evaluation. I use kinesiology. That's muscle testing. And it's akin in my world to EAV.
Yeah.
It's basically the same principle. So it's muscle testing, and I will show how I can localize where to do a therapy in the spine to limit the injection to the right location and limit the number of needles you have to put into a person.
Wow. Okay. Well, ozone injections don't hurt. Like I've seen it in Italy, all along the spine and the whole sacral area, and how to measure and how to the whole point. We haven't uploaded it because, you know, YouTube doesn't like needle videos. So I thought I'd rather keep that for myself. But it was really interesting how you can mobilize a complete frozen spine and problems in a short period of time.
Yes. And speaking of videos, I forgot. We have a whole library of videos of procedures.
Oh, wow.
If you attend this workshop, you have permanent access to it.
Okay, sold. Thank you so much for giving us information on the workshop. And I'm definitely sending everybody I know and I can that can travel.
Well, bless you. Thank you. And in this time of COVID, it's really valuable. I'll tell you, I've got 2 patients I'm treating right now. One came to me convinced he had COVID. He's in a hotbed in Sacramento, California. And I did DIV on him just for practical because I wanted to see how it would work. Because actually, I think DIV might be the best treatment for it. And while he had chest tightness and coughing afterwards, which is not unexpected, when I called him a couple hours later, he felt terrific. And the next morning, he said, I am a new man. I feel magnificent. And he used those words. I got another woman who came to me, and I'm sure she's got it, much sicker. She was just short of hospitalization. In her case, I chose 10-pass, and she got better very, very quickly. All of her pulmonary symptoms are gone now. There's some things that are left, but she's had like 3 10-passes or 4. And she's done extraordinarily well and grateful. She credits the ozone for saving her.
Yeah. Yeah, it would be so nice to just see proper testing done, proper evaluation. I was asked to take all my videos down, you know, like everything that contained COVID or coronavirus was immediately censored, YouTube and website and government, and got a whole bunch of letters. So they are not really keen to get that information out. Well,
right. Well, knock on wood, so far I've got 2 videos on YouTube that they haven't asked me to take
discover.
down, or they have taken down. Well, I'm sure they know it's there. But what I did, I'm not advertising ozone as a or the treatment for
No.
COVID. I published an article about a month and a half ago with Howard Robbins, and I'm talking about the article and what's in it and why ozone should be a good treatment for this.
Yeah.
And that's falling under a different category. Am I making sense?
Yeah, I know. It's the wording. I've been very good so far with all our cancer approach. But this time with my COVID, I just slipped into it and used 3 or 4 terms in the website. And that was like the red flag went up.
Yeah. And I was contacted too because I had the word treatment and COVID in the same sentence.
Yeah.
They didn't like that. And I was contacted. Everything was copacetic and fine. There were no threats other than a request to take it down. And I did, and I told them, but I'm going to leave up my article.
Yeah.
No problem.
Yeah. Good.
It's a published scientific article on why ozone should be the cat's meow for it. And that would be free speech. They don't seem to be upset about that.
Yeah. Yeah. Fair enough. Look, the rules are the rules. We can't bend them. We just need to live with them.
Yeah.
Live around them.
Yeah.
Okay, Robert, thank you so much. And I wish you all the best for your workshop and thousands of people lining up.
Thank you very much. But if there are thousands, we're still going to limit it because it's a quality workshop. You understand? This is hands-on. This is not like 100 people in a room. This is maybe 12, maybe if there's a demand, a few more, but this is hands-on. So we want quality.
Very good. Thank you so much, and you have a wonderful week.
Thank you.